research paper published in Frontier stated that veterinarians are at a higher risk of mental health issues. It was found in a 101 research interview. They are at a higher risk of depression, anxiety, and suicidal ideation. To address these issues, we have a very exciting and amazing guest with us. No, not a veterinarian. Rahim Thawer, ladies and gentlemen. Rahim Thawer is a psychotherapist, social worker, clinical supervisor, lecturer, and a writer. His work involves working with mental health and queer relationships. So today we will be discussing the mental health of veterinary professionals. Let's start with what mental health is, and then we can dive into mental health
Thank you
issues
so much,
and other
Dr. Ghazi,
variables.
for having
So
me.
the floor is
Uh,
all yours.
yes, I like your idea. Let's start with what mental health is. Um, Now, I think about mental health as part of physical health, but it requires different kinds of nurturing. So, lots of people talk about supporting your mental health in a similar way that you support your physical health. So, eating well, exercise, things like that. And I agree with that. But I think mental health requires additional attention because humans make meaning of a lot of things. Everything they encounter, they make meaning of. Um, some of the ways they are thinking can be unhelpful. And not everybody is like, by
Okay.
and large, most people have different experiences in life, right? Different stressors, uh, relationship concerns, experiences of
Yes.
success, failure. And so mental health ends up being about your day to day emotional experience. It also is about how you see the world and how you see yourself. So some people you might find are always thinking in a negative way. And before we say, oh, you should change the way you think, just think positive, I would say, no, let's take a moment to appreciate why this person is pessimistic. Why do they think in a negative way? I would guess that they've had some negative experiences.
Mm.
And so, based on that, it makes sense for them to predict things will turn out badly. That's just been their experience already. A common experience for people, that they carry with them throughout their lives is of being ostracized, being made fun of, being excluded. All kinds of social exclusion can really affect your mental health. I would say grief is another thing that really affects our mental health.
Okay.
And frankly, we don't spend a lot of time talking about grief. Um, and that's why I'm happy to be speaking with you today, um, because I often talk to people about mental health on the margins. How does it feel for you when you're a minority in the world? Maybe you're a minority because you grew up in poverty. Maybe you're a minority because
All
you're
right.
part of the LGBTQ community. When it comes to different professionals, some get more recognition than others. And so in this conversation, yeah, so in this conversation, maybe we'll talk about
I
what
totally
it's
agree
like
with
to
you on
be a
that.
professional who is disenfranchised in their grief, or their grief is not always acknowledged.
So that the thing you said of the negative person, that why
Mm.
that person is negative in his thoughts, like how that thing can influence your mental health, like being negative 24/7, how it can influence your
Yeah,
thoughts or your life on a
absolutely.
regular
So,
basis. Can
according
you explain
to
that?
cognitive behavioral therapy, our thoughts, feelings, and behaviors are connected. So, if you're pessimistic, skeptical, paranoid in your thinking, sometimes it's an appropriate response to what's going on. But if it's all of the time, then that means the way you're feeling is probably not very good, right? So if you are always anticipating negative outcomes, you're probably sad, miserable, maybe depressed. Uh, and so that mood that you carry with you, it creates a kind of stress, right? I think about it as um, carrying an invisible backpack, like a knapsack with bricks in it. So if you have trauma, right? Like you lost somebody at an
Okay.
early age, maybe you had abusive family members, maybe you were in an unhealthy relationship. The stress and the shame of all of these things adds to your invisible backpack, and you carry that around with you. And it colors how you see the future. So we have to alleviate some of the pressure of what you're carrying in your invisible backpack, because that's going to weigh you down. And when you're always negative and you're always pessimistic, you're not going to take risks. It'll influence your behavior. So you're not going to try something new. You're not going to connect with people. Um, and so there's a potential that you could be quite
Okay.
isolated, right? So I think we have to think about, if somebody says, "Oh, I'm not thinking negative, I'm
Hmm.
thinking realistically," I would say, "Okay." So when does that get balanced out with more optimism? It doesn't have to be completely positive, but a bit more optimism, because balancing it out is important. And the question I ask a lot of my patients is, how can you
Okay.
access your
All right.
optimism? You know, usually that involves a kind of practice with yourself, like taking care of yourself in some way, talking to
Hmm.
somebody. Now, I'm biased because I'm a therapist, but I really think talking about something can help dismantle the stigma, and it takes the weight away, you know?
So we will start from the very beginning. Veterinary students. Veterinary students face unique stressors and challenges during their training, such as the demanding academia, workload, emotional baggage from being able to work with sick and unhealthy animals, and not able to do anything because you are not yet
Mm,
licensed to perform procedures or do anything. So, how one student can start with addressing those issues, that that student is developing mental health issues, like he's
yeah.
going sliding
So
into
I
mental
think
mental
this
health
is
issues.
similar for a
How?
number of um, healthcare professionals that are in training. Um, a lot of people come from a background where they're expected to be perfect, and they're in healthcare. They want to help.
Okay. Yes.
They also are expecting perfection, and so perfectionism is rooted in a kind of anxiety. So if we are going to offer compassion to our patient, whether it's an animal or a human or it's the owner of the pet, you know, we have to start practicing self compassion for ourselves. And
Hmm.
we have to challenge the imposter syndrome, right?
Okay.
We have to be able to say, like, to our preceptors or whoever, is supervising us, I think I need to practice this. Or I'm going to practice this. I'm going to see this patient. Can you come in with me and add anything in case I miss it? We have to make use of
Okay.
the mentorship and the learning relationship and challenge our shame around that. I think people feel embarrassed. They feel like they have to know it right away. Um, and usually, when somebody is struggling with perfectionism or imposter syndrome, I say to them, whose voice are you hearing in your mind that's telling you that you have to be perfect, right? And they'll say, oh, it's my own voice. And I say, okay, but you didn't develop that on
Amazing.
your own, right? So tell me for a moment about your life, your family, your siblings, maybe your religious community. We all come from a place where we, are compared to other people, or we learn to compare ourselves to other people. Some people go into healthcare um, because their families have pressured them, And to become the doctor means that you're going to be able to support everyone in your family. That's a huge amount of pressure. Go ahead.
It is. I see a lot of people coming. Yeah, I see a lot of people who come from this mindset. Like they have a lot of responsibilities on their shoulders, and they have to do certain things to be able to enable and uplift the family's
Yes. And
social status
so
as well as financial conditions.
we can't change that, but I think we need to create space to talk about the pressures that we come into the work with, right? And we have to create a kind of psychological
Exactly.
spaciousness to think about problems, errors, challenges, and recognize that nobody is an expert in their profession until they've been doing it for 10 years or 20 years, right? For the first 10, 20 years, it's a practice.
Okay.
And you get better at the practice depending on what you see,
You are
what
learning.
you
Yes.
specialize in, and what comes to you. And that depends on so many
Exactly.
things, you know,
Exactly.
demographics, income of the area you're working in, the people you work with, etc. All of this kind of stuff. And so I find one of the difficult things with people who are training in different kinds of healthcare is that they're afraid to talk about not knowing, or they're afraid to talk about having challenges. And so they can't make good use of
Ah,
consultation opportunities. They can't make good use of their mentorship relationship because they're ashamed.
all right.
Mm.
Okay. Okay. So now moving forward, how as a student I can address this? Like now I have anxiety, or like in medicine we have this thing, we see the symptoms like my body temperature is rising, I will say I am having fever. How in mental health
Mm.
I as a patient can like label this thing? I am being anxious, depression, sadness, because there
Yeah.
is a lot of emotions out there. So how I can
Yeah. So
identify the
one
issues that I'm
thing an individual would have to
having?
do is say, do I think this anxiety is a symptom of something in my environment? Or is my
Okay.
anxiety chronic? Is it always there? I think that's an important distinction because um, anyone who's had trauma in their lives where their nervous system has been affected, they might be in a constant vigilant state. So it's true that their anxiety is a symptom of their trauma, but if it's constant and chronic, they're going to need different approaches for it. Like they might
Uh-huh.
be a good candidate for some kind of psychotropic medication. If your anxiety is more situational, right? You say, in this
Okay.
work setting, in this mosque, in this family setting, whatever it is, something happens and I tend to get very anxious or self conscious. I shut down. We want to explore the situation and the context. So the question I would ask is, when this happens, or when you go to this place, or when you're around this person, what goes on in your mind? What do you worry about? What do you think about?
Mm-hmm.
Um, is there a bad outcome you imagine? Do you imagine something bad is going to happen? And do you think it's accurate or not so accurate? So you
Right.
evaluate it. If it's not so accurate, right, then you know that I need to find a different way to approach this. So let's use an example, right? Maybe you could tell me about a situation
Okay.
where you might feel anxious in
Sure,
your
please.
work
Sure.
and we can work through it.
Okay.
Go ahead.
Okay, okay. Let's see. A cat. I'll give you a case that I encountered today. So a cat came to our hospital, and it was given all the medication. Everything was fine, and then the owner took the cat and then left. And then they called that the cat is vomiting and it went unconscious. I was attending that case. It made me hell
Okay.
anxious. Oh, what's going to happen? So we can take this case as an example. So to give you a thing, the
Okay.
cat is safe and
Okay.
out of any
So,
danger. It went good. So no
okay.
worries.
So when the pet owner called you
Yeah.
back
So we can take this.
and said The cat is vomiting.
Yeah.
You had a lot of anxiety. That is appropriate because you were worried,
Hmm.
right? So, what were you worried about? Tell me about your thoughts.
That what's going to happen to the cat because we administer the
Yes,
correct medication and we took all the right
yes.
procedures.
So, question that where you're like, what could it be? We already gave them medication. So, what you're thinking is, we misdiagnosed the problem. Did we administer the wrong medication?
Okay.
um, what else didn't we foresee? That's what you're thinking, right?
Yeah.
Now, if you if there's something you
Yes.
didn't
Exactly.
catch,
Yes.
you didn't foresee, what do you worry will happen now to the animal, right? So your subconscious thought is then,
Yes. Yes.
what if
Exactly.
the animal dies? Or what if I can't help? Does your mind go there? Okay. And if you can't help,
Yes. Yes. It
or
does.
if something goes
Definitely.
wrong, then what? What does it say about you as a vet, as a professional?
On a personal note, it is very devastating to see your patient die. And on a professional note, it becomes a
Okay.
very big question mark
So
on
in
my
that moment,
competence
I
as a
can see that
veterinarian.
your anxiety is warranted. You're anticipating possible loss of a patient and of your reputation. And you would come to question your own credential, your own competence. So
Yes,
the anxiety is warranted,
obviously.
but it's going to get
Yeah.
in the way of you problem solving. So, what do you have to tell yourself to bring your anxiety down? So, let's say your
Okay.
anxiety was at 9 out of 10 in that moment. To work with the pet owner who's going to be very anxious, and to work with the pet, you probably need to bring your anxiety down to 4. 4 out of 10. So, what are you going to tell yourself?
That we
Mhm.
will try everything to make the cat
Yes.
become
So,
healthy, and then we will try to
you'll
fix
remind
whatever went
yourself,
wrong.
I have the tools. Something's happening that I couldn't anticipate. It must have not been obvious. It's not my fault. It just wasn't obvious, right? You're also going to tell yourself, uh, I have all of the medical tools necessary to examine the animal, right? I'm going to do my best. I've succeeded in the past.
Exactly.
So these kinds of things will bring your anxiety down a little bit, and it creates a spaciousness for you to think,
Hmm.
right? I'm not saying it's not a serious situation, but if we bring the anxiety down, we can step into the role and think. And how did you feel when it was over? How did
Yes.
this
Yes.
feel when you
Exactly.
were,
Yeah, I was feeling very
yeah, and how
relieved
was the
when
pet
things
owner?
went good. Yeah,
Okay.
she was also feeling very well. Still a little bit nervous because the
Mm,
vomiting happened when she was going back to
yes.
her place. So,
I think this is another part of your profession that's particularly challenging. Um, never, never do you have a patient
indeed,
that
it
comes in
is.
on their own, right? It's like they always come in with their own.
Yeah,
Yes, they
they
have an owner,
accompany
a
a
pet
client or
parent,
a pet parent.
and you have to work with the
Yes,
animal. You have to work with your own diagnosis, prognosis, emotions, and then you have to work with the pet parent and their not just their emotions, but their understanding of what's going on.
as well.
And you know,
Yes,
you're probably also having to have a lot of conversations with people about end of life decisions, right? So people who treat humans have to do that too, but usually with humans, um,
yes,
the person in question, the patient, also, they have a say in some way. But in these cases, it's between the physician and the pet parent.
say,
They have to decide.
yes,
So it's a bit more pressure.
It was it was very
Yeah.
true, and I was able to relate with that. The client and the pet parent and the veterinarian, because the animal is unable to, they don't have any say in whatever goes to
Yes.
happen, be it the treatment or
Mm.
the euthanasia.
Hmm.
And we see this very frequently, like especially with dogs in chronic issues. Recently, I saw a case of a
Mm.
tumor, all the skull, everything had gone bad. From outside, it was good, but from the inside, when we operated, it
Yeah.
had gone bad. So these are the things we get to see a lot. As we are
Mm.
have talked about veterinary students, now let's move toward veterinary professionals, which encounter primary stresses in their daily working life: long working schedule, high workload, challenging cases, emotional distress, dealing with sick and injured animal, faces ethical dilemmas, difficult client interaction, and a burden of responsibility of animal
Yeah.
welfare, which ultimately leads to compassion fatigue. Now, if you can describe about compassion fatigue, because I see a lot of veterinarians and professionals,
Mm.
you see them on their
Yeah.
faces, the compassion fatigue. Like, because I am a budding veterinarian, because I am young, I see, because as we are here talking about veterinary mental health, I see the signs. So how, though, that guy who is into the field from
Yeah.
past
Well,
10,
okay,
15
let's
years
talk about
address
compassion
these
fatigue
issues?
and what it is. I often think about compassion fatigue as the cost of caring, right? And I think there's people in the field that will also say
Okay.
it's not about fatigue, it should be about compassion satisfaction. And compassion satisfaction emerges when we have adequate support, a healthy outlook, and some level of boundaries, parameters, or
Okay.
balance in our lives. So, before I talk about balance and compassion fatigue, I want to dispel a myth. A common myth is that, people will say we need to have work life balance. Yeah. So, I often think about compassion fatigue as the cost of caring. And common signs of compassion fatigue are like extreme exhaustion. You might find yourself being really irritable. Um, you might actually not be very empathetic in how you communicate. You might just be very like grim and pessimistic.
Right.
Your outlook on life sometimes changes. Um, you could get quite like sad in a persistent way. So it might look like dysthymia or depression. You might also feel quite detached from your work. When I've worked in healthcare, and I've been at a stage of compassion fatigue. I know that, I can see somebody's crying in front of me, and I'm just kind of thinking, like, is the workday almost over? Like, let's move this
Okay.
along. So, you're not a bad person if you feel that way, if you feel detached, but if you feel unmoved by things that should move you, you know,
Okay.
there's something has interfered with your ability to emote, to experience emotion. And that could be compassion fatigue.
Okay.
So,
I have a
compassion
follow-up
fatigue.
question. I
Yeah.
have a follow-up question
Mm.
to what you said. If it is not moving, doesn't this come as a coping mechanism? Like, when, if we talk about from a healthcare professional, you are seeing a lot of patient crying, you are bleeding, patient are crying, the
Mm.
client is worried. Then, and you are seeing this on a very regular basis, on a very daily basis, and in one day
Mm.
you are encountering three or four such cases in which the client is crying, they are very anxious, they are sometimes very angry. So doesn't it come as a coping mechanism, this compassion fatigue?
Yes. So, let's take apart the different features of compassion fatigue. So, if it's being detached, yes, I think that is it makes sense that that's a useful adaptation. You're coping with the environment, right? You're like, I can't, it's not sustainable for me to be so invested.
Okay.
Um, However, you need some level of compassion to do your job, because a big part
Right.
of your job is to care for the patient and to care
Exactly.
for the patient's loved ones. So if compassion is missing, if it's been sucked out of you, you also are not, there's a part of your job you're not doing, right? Otherwise,
Mm.
because if you take the compassion out of it, then it's just an algorithm. Then AI could be your physician,
Yeah,
right?
yeah. We veterinarians are on a high risk of being replaced by AI, as said in one of our research report.
So
So
we
yeah,
need the compassion. Now, one of the challenging things is that when you talk about compassion fatigue, burnout, vicarious trauma, people will often say you need a work life balance. And I just want to critique that for a minute, because I think it's not possible. It's not a real thing. When I think about our
exactly.
capitalist world, you know, if you sleep for 7, 8 hours a day, and you work anywhere from 7 to 10 hours a day, including your commute time, there's not that much time left for
Yep.
you to balance it out. Like some people will say you should have equal number of hours for 8 for sleep, 8 for work, 8 for your own time. But your own time isn't always your own. You have family, errands. It's not free time. It's like you're doing other kinds of labor,
Exactly. Yeah, exactly.
right?
I totally agree. Top
Yeah.
achievers have
So
made this thing work life balance a very famous go to thing. Like, you should have work
yes.
life balance.
So work life balance is possible if there's enough healthcare professionals, that there's less pressure on each person, if everyone gets paid enough to have a good quality of life,
Hmm.
you know, uh,
Okay.
you know what I mean? But like,
I'm getting what you're trying to say.
yeah, like it's the pressure we have on ourselves in our current system is just, it's too much, you know? So
It is.
anyway, all that to say, all I'm trying to say is that the system we work in is stacked against us and expects a lot out of everybody, you know? So
Yeah,
work life
it does.
balance isn't possible for a lot of people. What we can do is try to have some parameters or boundaries around how much we take on. So, for
Okay.
example, if I don't have compassion for my patients and I feel really run down and irritable, if I think about my thinking, it's going to be quite pessimistic. So I might have to think
Okay.
about some slightly more positive or affirming ways to think. I might also have to think about how the fatigue has impacted how I see myself, my own competence. And I
Okay.
might need to do some things to boost my confidence. And I might need to engage in more clinical consultation, right? So I think it's really important for people, whether they're social workers, they're veterinarians, they're working in a geriatric facility, they need to talk to other professionals about their cases, um, and to process what it feels like. There's different components, right? How did it feel when you talk to the pet parent,
Yes.
and how did the animal, your primary patient, respond to your treatment?
Okay.
Because there's two parts to it, right? And how do you want to approach it next time? For you, there's different layers, right? It makes me think about when we talk to people who are in pediatric care. It's never
Okay.
just the child. The
It's
child is carries
yes.
the symptom, and the parent is another part of it's part of the problem, or part of the larger issue,
Yeah, it goes
right?
both hand in hand. You have to deal with both.
And so part of the treatment is thinking about how do I more effectively work with the human, the secondary patient, in that setting. We want to talk about
Okay.
strategies, because they're coming in with personalities. They're coming in with their own anxiety, their own history. And part of your job is like also to relate to them, right? And so consultation on how you deal with those on an ongoing basis is so important.
Okay.
So I think
All right.
when we consult with others, when we process our emotions, when we create space to grieve, all of those things are an investment in ourselves as professionals who are saying, if I'm going to do this for this many hours a day, for this many hours a week, then I'm going to have this ongoing investment in myself built into my work.
Okay. All right. So now we have addressed compassion fatigue, how it comes hand in
Mm.
hand both for the client as well as the patient, and how you can cope with it, and how you can become more compassionate towards the patient as well as
Mm.
the client. Now we have talked from a individual point of view.
Hmm.
Now if we take this on a big scale, like if a veterinarian is working in a clinical setting as a GP in a small clinic or in a hospital setting, we have assistant nurses, all sorts of other veterinarians also, how we can
Mm.
address this compassion fatigue issue, because
Yes.
compassion fatigue, anxiety, depression is not limited to an individual, but I feel like to a community, the environment in which you are. So how we can address
Yeah.
this on that level, on a social level, because mental health
Yeah.
issues, people are very reluctant to establish because they will be labeled as mental, they have some disorder, they have psychiatric issues. How,
Yes. Yes.
especially in a as from a healthcare professional point of view, how we can deal with this thing and how we can address the mental health issues in this go.
Yes. I think on the one hand, so on a clinic level, doing like clinical or medical rounds can be very useful, right? So twice a week, doing a huddle, saying, here are the patients we've had. Everybody who sees them through a different angle, including the person who's the administration person or the medical secretary, they also can be involved to say,
Okay.
because they see the person when they first come in. Everyone's going to have a different perspective. So everyone can get an update on where the person is at. And when it's within what we call that circle of care, sharing information is appropriate, right? Because everyone's involved in that person's medical care.
Yes.
And I
Yes.
think that's huge in reducing the isolation. Isolation really can drive a lot of anxiety and depression.
Okay.
Um, the hierarchies and the set, like the hierarchies of, like, I'm the doctor, I'm the tech assistant, I'm the secretary. These hierarchies also create a lot of isolation, because then people feel like they have to be experts and they're not allowed to struggle. The administrator is going to say, I feel like I'm struggling, but who am I to complain? The doctor's the one dealing with all this. And then the doctor's thinking, they're all counting on me. How can I show them I'm struggling? I have to set an example for them. So in the workplace, medical and clinical rounds is a great way to break isolation, but
Okay.
also to humanize each person in the role, and it prioritizes mental health of all the workers as part of the team. We have to dismantle this idea that the patient who comes to see us is out there and we are somehow above them. No.
Okay.
We
Rather
also
than being in rather
have a
than
mental.
being in God mode, you have to come down and be a human.
Yes, yes. And as a therapist, I've seen a number of physicians in my practice who really struggle with having to be perfect, having a lot of pressure on them, and, they can deal with
Okay.
immobilizing anxiety as a result, um, their own alcoholism or substance use issues, um, their own, self-sabotaging behaviors like, uh, sleeping late, waking up late, missing appointments. All kinds of chaos comes up when we're feeling dysregulated, right? And we're
Okay.
under more pressure than we can handle. So physicians are at a lot of risk around mental health challenges. So my advice is really clinical rounds and peer consultation. Humanize everybody. Everyone should talk about, like, questions they have, things they're struggling with. challenges they're having with a patient, that kind of thing.
Sure.
That way,
Sure.
people feel like a collective and they feel supported in their role and they want to come
All
to
right.
work every day.
Okay. All right. So we need to humanize and we need to break the isolation barriers that we have and more of
Yeah,
medical rounds. Okay. Okay.
I think that's
Now,
one of the
shall
things.
we?
Another one is you could
Yeah.
do
Yeah. Please.
balance.
Yeah. Yeah. Please.
I don't
Please go
know,
ahead.
are balance groups popular there? Or have you heard of
What?
balance groups?
No.
No. Okay. So a balance group is a group that a lot of people do in medical training.
Okay.
Um, and I've only heard of a couple for veterinarians. But essentially, what happens is it's a group of people in practice. It could be homogenous, so all physicians, all vets, or it could be interdisciplinary.
Okay.
And you create a circle where one person talks about a case that feels unfinished or they have more curiosity about in the recent past. And they talk about the case briefly, and then the group asks them clarifying questions. They say, factual questions. I want to know I'm a little bit more about this case. And then the person who presents takes a step back, and the other people continue to process the case. But they don't criticize the person who's presenting. They say things like,
Hmm.
here's what I'm thinking about in terms of the symptoms. When I hear
Okay.
about the patient, I'm reminded of this. The feelings I heard in his voice were like this. So it's processing it from all the different perspectives that are possible. And then the person who
Okay.
presents just listens. And then
All right.
in the last few minutes, the person who presents is invited back in to see if they want to add anything. And briefly, they can reflect on the impact it's had on them to hear other people's perspectives. At no point is it about getting advice. It's not a clinical consultation. It's not clinical supervision. It's about hearing other people's perspectives to broaden your viewpoint and to make you feel more affirmed. And in the end, hopefully it helps shift something in you to strengthen your relationship with the client or the clients. So that's the Ballant group is it can be quite powerful. It's not resource heavy. You can run it within a clinic. You just need somebody to lead it. Um, yeah, and it can be very helpful as a support mechanism, right?
Mechanism.
It gives you another tool for processing what's going on, and I can send you information about it.
Sure, sure. I will love to share it with the audience out there who, and this is something interesting that I love the idea of like you as a person, as a veterinarian, you are sharing a case which you feel like even though we have this tendency, even the case went good, we have this self-doubt in us. I could have done much better, even though the patient is doing very well. So it is
Yeah.
it's a very interesting concept that I heard. I would love to see this people implementing in the future. Even
Yes.
hopefully the geek veterinarian will take this live in
Mm,
India.
yes. That sounds good. That sounds good.
Yeah.
You also, the last couple things you said, even when the patient is happy, I'm critical of myself. And I think
Yes.
there's something to interrogate there, right? Where do these unrelenting standards come from? And why do we
Sure.
critique ourselves? And why do we have positive beliefs about self criticism? Somehow we
Okay.
think that if I criticize myself, it'll force me to do better or it'll push me in the right direction. And so I think we
Hmm.
need to challenge that a little bit. Or you can also say to
Exactly.
yourself, if I'm nice to myself or if I say that I've done enough, that could also have a good impact. That could also be good for me as a professional.
All right. All right. Okay. So it is something very interesting, and people can learn more from this thing and implement in their clinics and their hospitals, which is going to
Yeah.
benefit both the client, the veterinarian, as well as the economy. Because if a veterinarian is in good mental health, they will boost the care to the animal, and it's going to profit. It's a profitable
Yeah.
thing. So I'll like to bring you back to the student.
Mm,
We When you are a student and you are learning and you have your superiors, your teachers, and they try to push you, they label you that you will not be able to do good. How does this affect, or does this affect a person, especially in healthcare? It's a very long journey. You graduate, you go into internship, clinical
mm,
rotation, then you go for your master's, your specialization, because it's a long 8 to 10 year of journey. Does
yeah.
these labels affect a person's psychology as a practitioner, or is it something good that, or bad? Like, what would you say? What's your say
Mhm.
on this thing? Labeling.
I think, yeah, I think lots of physicians have, like, their training puts so much pressure on them
Okay.
and so many unrealistic expectations that
Mm-hmm.
the pain they have to endure, the long hours, the criticism, the residency, it once they get through it, I think they tend to have, not tend to, they are vulnerable to a kind of narcissism
Oh,
where
okay.
they end up being, they say, like, I've made it through a very difficult system. You should be able to do it too. And so they are harsh with people who are studying under them. And I think this is a cultural shift that needs to happen in healthcare, where if you are training somebody, right, a student is going to need compassion, and a student needs a kind of environment where they can ask you for support.
All
If
right.
they're not don't feel psychologically safe to ask for support, then you're not creating a learning environment and you're setting them up to fail. So for the doctors who say, I don't
Okay.
think you can do this, or you're not cut out for this, I would say the doctor needs to take a step back and think about why they think that critical way of being is a good pedagogical approach. I don't think it's
Oh, okay.
scientifically proven anywhere that that is going to help teach somebody how to be a better physician,
Okay.
right? So I would be thinking, how did the doctor get to be that way? Right? And my thinking is, okay, it's a hard journey, and now you're resentful and you're not sure somebody else can handle that hard journey. So actually, let's talk about how to change the journey so it's not so painful. And two, if you're harsh with somebody, underneath it, when I think about it unconsciously, I'm thinking you might see that younger person as your competitor. And
Okay.
if you see them as your
Okay.
competitor, the underlying emotion or emotional experience is about envy. And so,
Hmm.
help with your envy, you're putting them down. So, if that fits for somebody, that's not going to be everybody's story. But if that fits for you, I would say the way we need to start thinking is this person's not your competitor. They are going to be a reflection of you. So, train them well. Because if you are
Okay.
hostile to them, they're going to perform poorly, and that's your fault. Right? So
Yeah.
think
Okay.
about it like that. This is not your competitor, this is an extension of you.
View.
So you owe it to them to honor them, right? They came into this profession for a reason.
Obviously.
They went through all the programs, all the tests. They're competent. If they're in front of you doing a locum, a residency, whatever it is, they have the skills. It's your job to help translate the textbook knowledge to the practice
To
knowledge.
practical.
And if they're not doing
Exactly.
well, part of the struggle is the relationship with you
Okay.
as their supervisor.
Student.
You got to think about that.
Okay. All right. Okay. This is something interesting you said, like the extension, because a lot of students, in especially in healthcare, they face this problem. Like they're getting pulled down. I know a lot of surgeons who are surgeons now
Mm,
in medical field. they have faced this similar issues, and especially gender issues to address. Like,
Yes,
they gender issues also plays a very major role, like say, okay, woman or a man or a gay or a lesbian,
absolutely.
because all these issues.
And the
Okay.
culture of medical students is often one of competition. They're trying to impress the supervisor or the physician, right? Because they are like, who's going to give me a reference? How am I going to become a fellow after this? How am I going to
Okay.
specialize if I,
Yes.
so they want to say the right things, ask the right things,
Thank.
present the best cases. And so we have to really shift the culture of the training to say, we don't need to compete. There's space for all of us in this field, and we're all going to have different growing edges. And I think
Okay.
I like that you brought up the gender, because I think the work, like this training program, is the right space to start talking about sexism and how we're going to
Yes, it
dismantle
is.
it,
It is indeed.
right?
Indeed.
Because yeah, that's a life, like that's a thing we need to change in our culture. Otherwise, um, you're going to see more women burning out and experiencing compassion fatigue. But also, in addition to that, there's going to be like bullying in the workplace. They're not feeling supported. Their intelligence or their clinical judgment is being questioned, right? So we need to talk about that bias, like from the beginning. That's part of the training, I think.
It is. It is. Okay.